Hello all, myself Mushida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today I am going to talk about Introduction to Anatomy. Let's get into the topic. Why we need to study the anatomy? What is the importance of anatomy? It is a foundation for all the medical sciences. It helps us understand the normal structure of the organs which present in our human body. Thereby we can come to a conclusion about the abnormal function. What are the subdivisions of the anatomy? Anatomy is broadly subdivided into gross anatomy, microscopic anatomy, developmental anatomy, and clinical anatomy. Let's see what are those. Gross anatomy. It is a study of structures that are visible to our naked eye. It includes regional anatomy and the systemic anatomy. Regional anatomy study about the regions of the human body. For example, upper limb, lower limb, abdomen, thorax. Systemic anatomy studies about the systems of the human body. For example, digestive system, respiratory system, cardiovascular system, nervous system. Next is the microscopic anatomy. Microscopic anatomy is the study of tissues and cells which are invisible to our naked eyes. So, this study can be done with the help of the microscope. Thereby, it is called as microscopic anatomy. It includes histology and cytology. The microscopic anatomy, we can study the tissues and cells with the help of microscope in detail. Next is the developmental anatomy. Developmental anatomy is the structural changes that happens during the lifespan and the development of the embryo to a human being. So it includes embryology. This picture shows you the developmental anatomy of the fetus. Next is the clinical anatomy. This is the application of the anatomy knowledge in our clinical practice. So that is the goal of all the medical sciences. So it helps us in medical imaging and in diagnostic purposes. The next is the anatomical position. Anatomical position refers to standard reference positions of our human body. For example, standing erect, face forward, arms at side, palms forward, feet slightly apart. These positions are having some terms to identify anatomically. So this picture shows you clearly the prone position, which involves the face facing downwards and the thorax back part facing the upward. This is the prone position. Lying upside down. Supine position, lying in a straight way. So the face faces upward, the abdomen faces upward. The next is the right lateral recumbent. That is right side lying. Next one is the left lateral recumbent, which is the left side lying. The next is the Fowler's position, which is useful for treating many of the patients who can unavailable to sit erect. The next is the Trendelenburg position, in which the head end is down and the lower part, which is the foot end, is elevated. The next is the anatomical terms. The terms which we are using in the anatomy are different from our layman words. So, these are the anatomical terms which we commonly use to identify the structures or the area which are present in our human body. So, superior, inferior. Superior is the structure which presents at the upper end is a superior. The inferior, the structures which represents that are present in the lower end, inferior. Anterior, posterior, which is called as front and back. Anterior is otherwise called as ventral, posterior is otherwise called as dorsal. Anterior refers to front, posterior refers to back. Medial, lateral. Medial refers to inner side, lateral refers to outer side. Medial refers to towards the midline of the human body. This will be considered as the midline, and the something which are present medial to or towards the midline is called as medial. Something which are present away from the midline is called as lateral. The next is proximal and distal. Proximal and distal or somewhat similar to superior and inferior. But we should not confuse those terms with each other. Proximal is the structure which is present at the top of a particular region. It's a proximal. The distal is the structure that is present in the down or at the end of the particular region. That is proximal and distal. Clear? So superior, inferior, anterior, posterior, medial, lateral, proximal and distal. These are the common anatomical terms which we use to study the anatomical structures of the human body. The next is the anatomical planes. What is planes? Planes are the surfaces which are used to intersect the human body so that we can study the structures present in the body easily. The commonly available planes in our human body are sagittal plane, frontal plane, otherwise called as coronal plane, transverse plane, that is otherwise called as horizontal plane. So these are the planes which intersect the body to identify the structures easily. Let's see one by one about these planes. Sagittal plane. Sagittal plane divides the body into right and left part. That is, we have to intersect the body in the middle so that the body can be divided into left part and right part, two equal parts. That is sagittal plane. That is otherwise called as mid-sagittal plane, which is the same as to sagittal plane. That is intersecting the body in the center. Mid represents the center of the body. That is mid-sagittal plane. Parasagittal plane refers to the plane which is lying parallel to the sagittal plane. That will also give you the right and left part, but is not an equal part. The right and left unequal parts of the human body is given by the parasagittal plane. The right and left equal parts of human body is given by the mid-sagittal plane. So that is the common difference between mid-sagittal plane and the parasagittal plane. Basically, the sagittal plane divides the body into right and left parts. The next is the frontal plane. It divides the body into anterior and posterior part, in which we have to intersect the body in the center, but we need the anterior and posterior part. When you use the frontal plane, you can get the body as front part and back part, the two equal parts of the human body. So that is the frontal plane. The next is the transverse plane. It divides the body into superior and inferior part, which I have already mentioned in the anatomical terms. Superior refers to upper part, inferior refers to lower part. So when you use the transverse plane to intersect the body, you can get the human body as a superior part and the inferior part. So that is the use of the transverse plane. Why the plane is important for us to study in the anatomy? So it is useful to describe the locations of the organ where it is present, either superior, inferior, anterior, posterior, or the medial, lateral. Those kind of anatomical terms can be well defined with the help of the planes. So that is why it is important to understand about the planes of the human body. Then it is used in imaging the human body. In imaging purposes, we can easily imagine the organ with the help of the planes. To summarize about the today's topic, I was talking about the structure of the human body, in which these structures are broadly divided into gross anatomy, microscopic anatomy, developmental anatomy, clinical anatomy. And we talked about the anatomical terms and the anatomical positions and the planes of the human body, which involves coronal plane or frontal plane, sagittal plane, transverse plane. So these planes are the basis for identifying the structures which present in our human body. So this is to summarize about the today's topic. Hope you all have understood about the basics of the anatomy, which includes the subdivisions of the anatomy and the planes of the human body, anatomical terms of the human body, and anatomical positions of the human body. I'll catch you in some other video. Thank you.